Glad to welcome everyone. I'm Dr. Vasyl Chaika, and today we'll talk about constipation. Why it occurs, what real dangers it poses to our bodies, and what you need to do to get rid of constipation once and for all without pills or any kind of enemas. And to be able to go to the bathroom for a bowel movement every day. So, constipation is considered to be when a person has a bowel movement less than 3 times a week. That's when it's called constipation. So what leads to the development of constipation? There are 3 main groups of causes. The first are causes related to the gallbladder and impaired bile flow. The second cause is the lack of dietary fiber, which enters the large intestine and is supposed to mechanically move through the gut and stimulate self-evacuation. And the fourth is a reflex reaction, where the emotional component prevails. And you need to understand the following. What are the negative consequences that these lead to? Thank you. Constipation. If, for example, this situation happens to you once, of course, nothing critical will happen in your life. Well, except for some aesthetic discomfort. But if constipation is constant, then it threatens the development of hemorrhoids, or, for example, it's worsening if it is already present. It can provoke the appearance of anal fissures. This is also discomfort. Rectal prolapse can also occur. Well, and there are a lot of myths here moving on. For example, that constipation can cause colon cancer. It cannot lead to any kind of cancer at all, because the causes of this condition are completely different. It can, for example, lead to a deficiency of vitamins and microelements. No, because all of this is absorbed in the small intestine. Remember, please, that constipation, it's the very last section. Fecal matter accumulates near the exit, while all the processes of absorption and synthesis of anything happen higher up. So it does not cause a deficiency of micro or macro elements. Or in general, it does not affect absorption or the intestine's ability to extract nutrients. Now let's take a closer look at the groups of causes and what exactly needs to be done to prevent constipation. So the first group of causes is everything related to the functioning of the gallbladder. It is bile, as we already know, that stimulates peristalsis. That is, the contractions of the intestines that push the food bolus along, downward and actually form the stool mass. Therefore, when there is a disruption in bile flow, this leads to a slowdown in peristalsis. And as a result, the stool moves more slowly through the intestines, which can cause constipation. So, how do we deal with this? It's actually very easy to address this. First, you need to include spicy, bitter, sour, and fatty foods in your diet, gradually, so that it's comfortable for you. And also practice visceral therapy. So now, without going into detail here, I recommend you watch this video where it explains what you need to eat, how to do visceral therapy, and how to completely eliminate the root cause, which is based on problems with the gallbladder. Now, when we talk about nutrition, that's the second group of causes. And before we talk about nutrition, I want you to know that some medications can cause constipation. In this case, these are medications that lower cholesterol. Why? Because they actually block it. The bile acids are derived from cholesterol itself, and this slows down intestinal peristalsis. We talked about this in the first group of causes. Also, certain antihypertensive drugs, diuretics, and some types of medications used to treat depression. They can cause constipation. So please, if you are taking something on a regular basis, check the instructions to see if constipation is listed as a side effect. If that's the case and you are experiencing constipation, please consult your doctor so that we could find the right solution to this situation. Now let's talk about food. This second group of causes includes, first of all, something very simple. Improper water intake, and secondly, a lack of sufficient fiber. For example, what should you do in this case? First, we should drink water in portions of 100, at most 150 milliliters every hour throughout the day. The water should meet certain parameters, and you can now see these parameters on your screens. That is, every hour if you wake up, for example, at 7 o'clock, you drink at 7, at 8, at 9, at 10, at 11. And I recommend continuing to drink water in this amount until 7 o'clock p.m. So how can you check if you are drinking enough water? After all, some people say you need to drink 5 liters, some say 3, others say 30 milliliters per kilogram of body weight. So that's how much water you should drink. Remember, the norm is always individual, and it is determined for you so that everything is clear for you. It can have a slightly straw yellow tint throughout the day. Morning urine always has a color, but if you start drinking enough water for yourself, it becomes clear or just slightly straw yellow. That's why water is important. The second important point is fiber intake. This is where people make a mistake. They say you need to eat porridge. And for example, they start eating rice. But rice, on the contrary, causes constipation. Because, for example, those from the older generation, you all know, if someone has diarrhea, what do they always give? Rice porridge, and it's often undercooked. Constipation can also be caused by foods that contain a lot of gluten, because they will paralyze the function of the small intestine. That's how it works. That's why we need to consume the right kind of fiber in sufficient amounts. What is that? It's basically vegetables. But people always follow this recommendation. They eat a lot of vegetables, but then they start to feel bloated from these vegetables, meaning they experience a lot of gas. That's another mistake. Why is that? Because the amount of lactobacillium bifidobacteria in your gut isn't enough to digest that fiber. So what should you do in this situation? What is the right thing to do here? There's a very simple solution. You can eat foods that are rich in fiber, for example, dietary bran, wheat bran, or rye bran, for instance. It doesn't really matter which one. You take this bran and you need to prepare it properly. So, what is the method for using bran to help yourself with constipation? You take 2 heaping tablespoons of this bran, put it in a saucepan, pour in 500 milliliters of water, and bring it to a boil. Once it comes to a boil, you remove it from the heat. Then it will swell, and this porridge that forms, you need to eat all of it throughout the day. You can add it to a salad, to soup, or wherever you like. In other words, into your food. You need to eat this porridge within a day, and you do this for 3 days in a row. If during these 3 days you have a bowel movement once a day or once every 2 days, that's good. This dose is suitable for you, and you continue taking it for a month. But if this doesn't happen and you still have constipation, then the next time for the next 3 days you should take 3 spoonfuls. That is, you take 3 tablespoons, put them in a pot, again pour in 500 milliliters of water and bring it to a boil. And you eat this porridge throughout the day. And again do this for 3 days. If you still don't have regular bowel movements, then add a 4th spoonful. If not, after 3 days, add a 5th. In this way, you will determine for yourself the necessary amount of fiber that will help you have regular bowel movements. Of course, there are also recommendations. For example, it's better to consume psyllium, or for instance, it's better to eat flaxseed because flaxseed is very beneficial. It's simply fiber. So which fiber should you consume? It doesn't matter. If someone tells you that one type of fiber is better and another is worse, just remember, that's simply marketing. I always say that our health is right under our feet. But what else is important here? They ask, what about children then? Please remember that for children, and I recommend this for everyone else as well, you shouldn't start with a lot of fiber, but with the first step, which tells us how to do visceral therapy. It will help us regulate the upper sections of the intestines, and often that's enough. That's why the second step always comes after the first. And now let's move on to the third step. Now let's talk about the emotional component. So what conditions does a person need to be in, emotionally speaking? The brain effectively blocked normal bowel movements, essentially causing what is medically known as intestinal paresis. So the very first and primary reason is when a person doesn't have their own personal place, has unfortunately lost it for some unforeseen reason, or it is simply completely absent from their life. Why is that, you might ask? Because biologically, we, animals and all living beings, mark our territory with feces and urine. So when I don't have this territory, or I'm forbidden to be on it, or I can't be where I want to be, what I consider my territory, this can lead to constipation. The second situation a person might find themselves in is when they lose contact with someone. For example, let me give you a very simple example. A person had a best friend, but for some unclear reason, this friend stopped communicating with them. And now the person is worried, thinking, how could this happen? What went wrong? I can't communicate with them like before. I want to preserve this friendship. This will lead on a behavioral level to a condition that we call constipation. The third reason is when a person suddenly loses contact with someone close to them. For example, the person passed away. It's unfair. Why did this happen? Why did it happen at this particular time? After all, I still had so many plans with him and so on. So this kind of situation, especially in the current conditions we live in during wartime, happens very often. And so those 2 points that we discussed, a person does everything but nothing happens. Because if this emotional component is not completely released and the person does not accept the death or separation from this person, the constipation does not go away. Another reason is when a person finds themselves in circumstances where they cannot, let's say, let the situation pass and let go, accept the loss. And often such a situation, for example, happens when a person wants to but cannot sell, say, their house or car at the price they would like. Or, for example, a mother has a small child and the child does not take the bottle the way she would want. And for some reason the child doesn't poop the way the mother would like. That is, she can't accept it, she can't let go of the situation, she constantly sees it as a problem. As a result, constipation will also occur. And also when a person finds themselves in a so-called hopeless situation. So what is biological hopelessness? Is it some kind of catastrophe? No, these are ordinary circumstances, and an example of such a situation could be when a child doesn't want to go to school. But the parents say it's necessary. Society says it's necessary. And so this child goes, and for example, at school, they don't poop, and for 2 to 3 days, for instance, then constipation occurs. But when the child, as the mother says, completely relaxes, doesn't have to go to school on the weekends, then they have a bowel movement. And then the whole intestine becomes bloated. Oh dear, it's a problem. What should we do? But the real problem lies elsewhere, in the child's perception of that school. Or this kind of situation often happens as well. For example, moving somewhere. People travel somewhere and need to go from one place to another for an extended period. But what about the house there? But how will I be on the road? What will happen to me there? I don't know any of this. You might say, well, yes, this is a normal situation. Yes, it's a normal situation and maybe a normal reaction for you because you're used to acting this way. But it is precisely this situation and this perception of the world that can lead to constipation. What? What should you do in such cases when the emotional component prevails? Remember, the first thing we need to do is make an association. Okay, stop. I've ended up in these circumstances. I'm perceiving this in a certain way. And as a result, my body gives me a hint in terms of what is happening to me. A change on the physical level in the form of constipation. So constipation is not a problem. It didn't arise from stress. And stress is not the cause of constipation, but rather a reflex reaction. And as long as I remain in this state, I will have constipation. So I need to find a solution, a way out of this state. And this solution should satisfy you. For someone, it might be changing schools. For someone else, it might be forgiveness and acceptance that the person has left. That is, you need to talk about the problem that is bothering you. It's enough to simply talk to 5 people about the emotions you're experiencing. Not about the problem itself, but about the emotion you are feeling. And in most cases, the emotional component disappears. So talk about your problems, voice them, share them with at least 5 people, and then the emotional component loses its power. And now I ask those of you who have had this problem to share what you did when you experienced constipation and whether it brought any results. And now I'll summarize our little video lesson. I want to emphasize once again that only a comprehensive approach, when we address emotions, use visceral therapy, eat properly, and have the right outlook on life, will allow you to live without any medications or enemas. And every day, as they say, you'll have a good bowel movement.